Hi, I'm Dule Hill. If you're watching this, you've already done something important. You've recognized that urgency, frequency, and leakage are worth addressing. Maybe you started talking about them. Maybe you've already been treated for BPH, but you're still not where you want to be. So let's talk about what comes next, because there are real options for managing OAB.
So when I started talking about the doctor, the things that mattered to me the most was sleeping through the night. And then my other goal was to still be able to have sex with my wife. I haven't been fully happy, and now I wake up in a better mood, more refreshed, and just happier.
Well, now that I'm on medication, my favorite thing is driving, and I can normally, make the entire trip without having to constantly stop or also have an accident. I go to the movies and I'm able to, sit through a movie.
So now that I've been treated, I feel like a kid again, which is great because I'm retired. So now I can do basically whatever I want and do the things I've always wanted to do that I haven't been able to do in the past.
A full night's sleep, a normal drive, a whole movie. That's the goal. And the way there is a conversation with your doctor about what fits you. If you're managing both BPH and OAB, you may have specific questions about what's causing your symptoms and how the options fit with your other medications. Let's hear from our expert.
Hello, I'm Dr. David Staskin, a urologist in Boston, Massachusetts, and I'm here to talk about therapy for both OAB and BPH and when these symptoms occur in combination. Some of the treatments are behavioral, changing habits, changing fluid. Some of them are addressing underlying conditions. But one of the things that's available are medications. The antimuscarinics, they block the bladder contractions that are causing the problem and decrease some of the sensation from the bladder. The beta-3 agonists, they will relax the bladder, allowing the bladder to hold more urine. BPH is the same. Treatment may involve medication, alpha blockers or alpha reductase inhibitors, minor surgical procedures, or more ablative procedures, which are the classical procedures and aren't necessary for every patient. Patients who get alpha blockers, 70% have improvement enough in their flow that they don't go on to further therapy. What about the patients who have both conditions? A lot of times with treatment of the prostate, no more treatment is necessary because both types of symptoms resolve. In a group of patients, some patients will have the prostate treated, but will still have persistent OAB type symptoms. These patients will respond to treatment for OAB.
Here's something important. Not all treatments feel the same day to day. Let's hear more about side effects and what to watch for.
The antimuscarinics are classic medications, but they're associated with dry mouth, constipation, blurry vision, and in some elderly with some sort of mental fogginess, which has been shown. And so it's important to talk to your physician about the side effects that you've had on your medication. What is the other class of medications? We mentioned these, beta-3 agonists. They're not antimuscarinics, so they don't have these classic antimuscarinic side effects. Regardless of what class of medication you get, talk to your physician about underlying conditions or concerns. Perhaps you'd like a once-a-day medication. Perhaps you'd like a pill that can be crushed. Perhaps you have underlying hypertension. Perhaps you're on multiple medications and concerned about interactions between the medications you're taking and the medication you're being given. Let's talk a little bit about reasonable expectations once you've picked a medication. I usually find that some of the medications may take at least a week, but I like to give the patient a full course of the medication before we consider switching or changing or assuming that we're treating the wrong thing for at least a month. The studies that are done on these medications usually involve taking the medication for 12 weeks.
So don't suffer in silence with side effects, and don't give up too soon if relief takes a few weeks. Your doctor can only help if you tell them what's really going on. One thing everyone agrees on, tracking your symptoms and staying engaged with your care team makes a real difference.
A diary is very useful. I find better data, better treatment. So before going back to the physician or actually before starting your medication, do what we would call a baseline diary, just for a day, and go ahead and write down how often you're going, what your symptoms are, discuss this with your physician, create communication, which will lead to better patient care.
You've learned that stigma shouldn't keep you silent and that managing OAB is an ongoing conversation. You don't have to accept bladder symptoms as your new normal and keep the conversation going. That's how men move from resignation to relief. For more, watch the full series and share it with someone who needs it.